Hi folks, I'm Adrian. I work for Cord Analytics, so we offer expert advice and specialization in complex analytics, including AI, data systems, and ultimately we are excellent at fraud detection using those analytical tools. In the media recently, there's been a whole lot of interest in ambulance ramping in the health system, so I thought I'd share a case study of how one small team of data analysts solved ambulance ramping, and it only cost them it cost them less than $10,000. So I thought I'd take you through that. The first thing to figure out is what is the purpose of a hospital bed. In most cases, it's actually a transition or a holding spot between different types of services. So whether you're going to be admitted to a specialist ward, whether you're getting some imaging done, whether you're waiting for a blood test or about to get a blood test, we're going to see someone particular. You're in the hospital and there is another health service that's going to be provided to you. So the hospital bed itself is actually like a waiting or a transitory place. And when a hospital is overloaded, so let's say another ambulance has turned up at the door and more patients are being ushered in, it's impossible to know what is the cause of so many beds being full at that point in time, because all the ambulance staff know is that we've got another patient, and the doctors know we have nowhere to put them. And in the moments, you can't like build a new hospital. You can't buy a whole bunch more of machinery to do things. You're very in a condensed situation where it's very hard to change what your levers or change things in that moment to sort out the overload. So what a team of data analysts did is they put an iPad on every bed in the hospital or in the emergency area particularly, connected up to the Wi-Fi, and then had all that data feeding in to a Power BI dashboard. Now, what they were asking was, what is this patient waiting for? And that's it. They told the nurses how to just a simple form that was automatically loaded, and just click on, yep, patient in a bed, and then choose which option they're waiting for. And that was it. And that data just fed into live dashboards. Well, what they found is that they started out on like Monday or Tuesday, and come Friday afternoon, they had a very big surge of patients, and the ambulance ramping started very quickly in the Friday afternoon. Well, they looked at the data when they got in, and they found that actually on a Friday afternoon, there were a huge number of patients that were waiting for a scan to be done. So what would often happen is there's some procedure had happened, but before that patient is released, they get a scan done to confirm that it was successful or being suitably managed before they're released. But this imaging team went home at 5 p.m. on a Friday. And so all that caseload just started to build up and build up and build up and build up. And so, even though it was completely unknown to the staff at large, the real cause of that situation of ambulance ramping was that there wasn't any staff to do the medical imaging scanning that would allow a person to go home. So once they had the data and they saw literally this is causing the problem, they called in a couple of imaging staff, paid them overtime, and then they were able to solve that backlog quite quickly. So often when we hear of ambulance ramping, we think, oh, we need to build more hospitals, hire more staff, yeah, a whole bunch more machinery and equipment. But actually, the main thing to do is, have we optimized this system? Yeah, it was actually a very, very cheap fix to a very expensive problem, and a problem which has huge and very significant outcomes for the people affected. And if you don't get to see a specialist in time or get the thing that you need to get done. So yeah, all it was the cost of an iPad and the cost of a data analyst to connect all that up to a Power BI system. And then literally the data's all there and they can figure it out. So what can be done about it? Well, healthcare is as much about the optimization of a system as it is about the ability of a physician. In the healthcare system, largely the administrators who administer it are medical specialists. But the two words to note, healthcare and system, I think everyone understands that you need to that lots of specialists focus on the healthcare, there isn't much being done on the systemy bit. So look, a very simple example is Bunnings. I go to Bunnings and I want to buy something. I look up on their website and it'll tell me which stores have it. And then it'll tell me not only the store that has it, but the aisle and the bay of that item. Now imagine how much work has been done in the background to connect all their inventory management system up, just so a customer has full awareness of where everything is. So I can go, well, I could go to this store, but I have two of the three things I want. But I can go to this one and have all the three things I want, and here's exactly where they are. Bunnings isn't more important than a hospital, but Bunnings have invested significant amounts of money in optimizing their systems. And frankly, even that level of optimization is unheard of in public hospitals. The solution often isn't more beds, more wings. Look, in some cases it is, absolutely, but it's actually, rather than thinking about more of the same, thinking about something that actually optimizes what you've got. Yeah, our medical administrators have spent decades understanding the human body. They haven't spent decades understanding digital systems, the economics of resource management, and how to optimize complex systems. And actually, if we want to improve our health system, it's actually that the delivery of optimization is the key step that often we're missing.